Welcome to the NYU Langone Dental Medicine Postdoctoral Residency Program. Thank you for your interest in advanced education in the Pediatric Dental Residency Program in Columbia, Missouri. Here's a little information about the leadership of the Columbia, Missouri site. Our program director is Dr. Daniel Kane. Dr. Akhilesh is our Senior Associate Director, and Dr. Shivaraman is our Associate Site Director. The clinical requirements for the pediatric dental residency training are formal training in anesthesiology, which is 20 days and will take place at MU Children's Hospital. There will also be 10 days of training in different aspects of pediatric medicine and 5 days of inpatient pediatric medicine training. These will also take place at MU Children's Hospital. Every resident needs to complete at least 20 cases in the operating room, and they will also need to complete 50 cases as PGY1 and PGY2 in oral sedation. The training in orthodontics with special healthcare needs happen throughout the first and second year of training. Research will also happen with certain milestones throughout the training. Resident orientation will take place via Zoom and will be led by Dr. Kane. The topics will include HIPAA program requirements, professionalism and expectations, benefits, and cultural diversity. There will also be a separate research orientation which will help you understand the research process, the timelines, and the available resources, all of which will help you fulfill the expectations of the research aspect of training. In addition, you will have site-specific orientation at the Columbia, Missouri location, which will be conducted by our Associate Director and on-site faculty. This will include typodont calibration exercises, electronic records and documentation, and site-specific protocols for the hospital, and the outpatient rotation at the Compass Health Children's Center. We will also cover prevention and treatment planning, dental materials, basic topics in pediatric dentistry, and the health center's expectations. Let's talk a little about Columbia, Missouri, where the training program will take place. Columbia was founded in 1821. It's located in Boone County, Missouri, and the population is slightly over 120,000. It's home to 3 different colleges: Mizzou, Columbia College, and Stevens College. Columbia is located 30 minutes north of Jefferson City, which is the state capital, and the main economic drivers of Columbia are education, healthcare, and insurance. A fun fact about Columbia is the columns you see in the picture. Columbia is known as the Athens of Missouri. Columbia is also affectionately known by the locals as Como, with one of the largest state games in the U.S., the Show Me State Games. Columbia is also home to the Rocky Bridge Memorial State Park, and another little-known fact, the homecoming celebration was a tradition that was born right here in Missouri. It's very important for incoming residents to understand the oral health status of Missouri. On this slide, you'll see that 1 out of every 2 third-grade children had a history of tooth decay. 29% have untreated tooth decay, and 3 out of 10 have protective dental sealants. Our goal as a health center is to address this population that is in need of access to care. Every site of NYU Langone has its own story and personality. Pictured here are Dr. Shivaraman's personal mentors that motivated and supported her to start a residency program. The first photo is Dr. Paul Casamasimo, a mentor and one who instills a love for training and education. Next is Dr. Okuji. And finally, Dr. Kane, another mentor. We hope for all residents to find their own mentors in each of the various aspects of the program. And now, a little bit about Compass Health Network. Our mission statement is Inspire Hope, Promote Wellness. Compass Health Network takes a personal-centered, integrated approach to caring for customers. This healthcare model focuses on treating the whole person and is a collaboration of care involving the individual customer, personal providers, and, when appropriate, family members. Our efficient and effective services are enhanced by data and technology to ensure customers receive evidence-based care delivered in the right way, at the right time, and in the right place. This is very similar to what is done in our pediatric dentistry program. We focus on the whole child, creating a collaboration of care with the parents, the child, and the provider. The Columbia Dental Office started as Family Health Center. It was established as a collaborative effort in 1992. In 1999, Family Health Center became an FQHC, or Federally Qualified Health Center. Dental services were first added in 2002. Dental services were then added to the biggest medical building of Compass Health in 2019, and Family Health became part of Compass Health Network through a merger in 2020. The merger has provided a lot of opportunities and has helped us increase access to care and improve the quality that we provide to our patients. Our service area is the central region of Missouri, where Compass Health Network has multiple medical, dental, and behavior health clinics. Compass also has numerous clinics serving the western, southern, and eastern regions of the state. Pictured here is our team. They are a wonderful group of pediatric dental assistants, all trained to mainly see children. Pictured here is our faculty at the site, with whom you will communicate throughout your training. At the site, we have Dr. Michael Cottom, who recently joined us as full-time faculty. Dr. Cottom comes with several years of private practice and teaching experience. Next is Dr. Crystal Raya. She is an NYU Langone, Rhode Island graduate who also served as a chief resident in her own program. Dr. Shivaraman is the site program director and full-time faculty. The second photo is of Dr. Jennifer Rasu, who is a dental anesthesiologist by training and works with our residents for sedation procedures. Shown here is our wonderful first batch of graduates, Dr. Gordon, Dr. Amanda Morgenthal, Dr. David Kim, and Dr. Christy Tran. All passed their QE exam and are preparing for their oral boards. This is a photo of our second batch of graduates, Dr. Fawn, Dr. Amin, Dr. Malapeti, and Dr. Amila, who are all in private practice. Leanna is our residency coordinator and helps manage our scheduling and resident activities. This map shows all locations for your various rotations and clinical requirements. Everything is within a 10 to 15-minute duration of travel. Shown here is Compass Health's new Children's Center in Columbia, Missouri. At this location, we provide integrated health care for the whole child, including pediatric primary care, pediatric dentistry, children's behavioral health, and vision services. This facility features a welcoming lobby and waiting areas, operatories with plumbed nitrous, a spacious resident bullpen, and comfortable exam rooms. Our pediatric dental clinic, where you'll be working daily, is located at 200 Portland Street in Columbia, Missouri. Occasionally, residents will rotate at the Broadway Bluffs location shown here. The pediatric outpatient rotation will also be at the Children's Center. Here are the photos of the pediatric outpatient clinic. Shown here is the University of Missouri Hospital, where all rotations will be held for inpatient pediatric medicine, anesthesiology, emergency room, and on-call. The Thompson Center is where residents will rotate in CP Clinic and Down Syndrome Clinic. In addition, this is where one resident every year rotates in Lind rotation. Progressive Orthodontics will host residents for a rotation with Dr. Synthil Arun, orthodontist. NYU Langone really believes in advocacy training, so as a part of your residency, you will have to complete individual level, community level, and legislative level advocacy projects. This will help you understand and prepare for the future advocacy efforts needed as a pediatric dentist. Here are a few testimonials of NYU Langone dental medicine education from our own residents. I know of no other program that provides such exposure to need and outreach. Our program trains the hands that heal the helpless. I love being associated with residents located around the country. The sharing of experiences, education, and faculty wisdom was priceless. We work hard, but we also have a lot of fun. Here are pictures of residents showing camaraderie and teamwork at different functions. Feel free to email Dr. Shivaraman if you have any questions. Thank you for your interest in the Pediatric Dental Residency Program training at Columbia, Missouri. Have a great day.